In the Moby Dick randomized clinical trial, very preterm infants were supplemented with an omega-3 fatty acid called DHA or a placebo until they reached 36 weeks postmenstrual age. We now propose a long-term follow-up for these children, which would include an assessment at school age combining a brain MRI with a neurodevelopmental evaluation. Yet, we know that there are many challenges to anticipate with long-term follow-up studies, and difficulties with retention of participants is a major threat. But what about pediatric brain MRI studies? What are the factors involved in a parent decision to make their child participate or not in a follow-up study with brain MRI? Well, there is very limited data in the literature, and that was specifically the objective of our study. So we conducted semi-structured interviews with the mothers when their child was 5 years of age. The interview guide was based on the theoretical domains framework, a well-established approach which has been developed to understand the key factors in a behavior. Here, the behavior of interest was the enrollment and participation in the proposed follow-up study. It's a total of 41 mothers who completed the interviews. The child's desire to participate was identified as a key facilitator in their decision to enroll them. This highlights the need to adapt the recruitment material to both the parents and children. Another key factor to participation was related to the anticipated benefits to the child. Here, the mothers were motivated to have information about their child's development, along with the results of the brain MRI. So this suggests the need for appropriate counseling following the assessment with available resources for the child and the family. Now looking at the barriers. The most important one was related to concerns about the MRI procedure. More specifically, parents were concerned about the anxiety their child would experience, the safety of the brain MRI, with concerns around exposure to radiation and the need for general anesthesia. These are important misconceptions that will need to be addressed. Not surprisingly, logistical factors such as the impact on school or work attendance along with traveling costs were raised as an important barrier to participation. It would be important to have some flexibility around visit scheduling to help parents to attend the appointments. In conclusion, these findings will be used to inform our long-term follow-up and hopefully will also be helpful to other researchers doing pediatric MRI studies.